Welcome back, everybody. Bladder health is something that many of us take for granted until we start running into problems.
Well, our next guest is here to take us through some of the most common bladder-related issues and explain how to navigate them. Please welcome back to the show. You know her, you love her, Dr. Sheila Wijayasinghe.
Okay, Dr. Sheila, let's start with some stats. How common are bladder issues for women?
They're very common. I'm glad that we're here talking about it. So about 50% of women will have a bladder infection in their lifetime, probably more actually.
Yeah.
And many actually go on to develop recurrent infections. So 20 to 30% will continue to have infections throughout their life.
Oh, wow.
About 30% of women also experience incontinence, which is a really common issue as well that we don't talk about enough. But it's not just a women's health issue, it's also a men's health issue. 5% of men get UTIs and about 10% are incontinent. It's one of the main reasons people come to see us in the doctor's office and visit the emergency room and hospitalizations for urinary tract infections that are not treated.
Right.
So it's really important that we do talk about it.
Oh, wow.
Okay, so let's start with UTIs, urinary tract infections. What are they and what causes them?
Yeah, so UTIs is an infection of the urinary tract, which basically happens when a bacteria from the digestive system, usually E. coli, travels from the outside up the urethra into the bladder and basically builds an infection.
Yeah.
We usually talk about lower urinary tract infections, which is of the bladder, but there's also the upper urinary tract infections of the ureters and the kidneys, and that's much more serious. And so that's really important, but usually we focus on the lower urinary tract.
Right.
The symptoms of bladder infections are no joke. Like if anyone's ever had a bladder infection, you know how uncomfortable it can be. We have symptoms of urgency. We have to go frequently to the bathroom. You might feel burning sensations when you also urinate. It can be cloudy or strong odor associated with your urine. If there's blood in the urine, that can be a sign of the bladder infection as well, or pelvic pain. And those are all reasons to get help because there's certainly UTIs, which we treat, but there's other things that can also mimic UTIs, like STIs and otherwise. So we always want to be aware of that.
So why is it that it seems that UTIs impact women more than men?
Absolutely. So it's really an anatomy issue. So our urethra, so the tube from the outside to the bladder, is shorter. And so the pathway is shorter for the bacteria to just make its way in.
Oh.
Yeah, it's just shorter.
That's so interesting.
This long. Well, not this long, but like this.
Sorry, let's get serious. Sheila, I need you to behave.
Yes. So the other risk factors are with for women are sexual intercourse because it can push the bacteria up, and also pregnancy is a big issue for folks because of anatomy changes and hormone changes, and then perimenopause and menopause also changes that we experience increases the risk of bladder infections too.
Is there any chance of us preventing them?
Yeah, absolutely. So we always talk about prevention in the form of hydration to keep flushing your bladder out, wiping front to back, and actually figuring out why you're having the UTIs in the first place. So if you have recurrent infections, is it because it's happening after intercourse? In that case, I will actually sometimes treat my patients for bladder infections that are specifically related to intercourse. I give them 1 tablet of antibiotics. It prevents the infection from setting in. If they're in perimenopause or postmenopause or even postpartum and they're breastfeeding and they get a UTI, they might need vaginal estrogen. Or there's also some evidence mounting for cranberry extract, not the juice because it has sugar, but the extract has also been found for people who have recurrent UTIs to be helpful as well for prevention.
That's great.
Yeah.
Okay, so let's move on to incontinence. This is a big topic, but what is it? Describe what it is and what are the main causes?
Yeah, so it's the loss of our bladder control, basically, that leads to leakage. And it can be really uncomfortable. It happens postpartum. It happens after a delivery or any surgery that we may have had, post perimenopause and menopause as well. It happens in men when it's related to prostate issues. But it's so important that we talk about it because, again, large numbers, 30% is what's reported, but it's likely higher. But it really causes a lot of disability for people because I have patients who don't leave home because they don't want to be away from their bathroom.
Yeah.
And they're worried about having that distance. So it's a really important issue that we talk about.
Presumably there are different types?
There are different types, yeah. So there's the common ones. We've all been incontinent at some point, like if we laugh too hard or giggle or are tickled. But those are like the stress incontinence is when leakage happens with physical activities, when our intra-abdominal pressure increases, so coughing, sneezing, that kind of leakage. We have urge incontinence, which is when your bladder muscles actually contract at a time that you don't want them to contract, and then you have a sudden strong urge to urinate. And then there's a picture that's called mixed incontinence, which is a combination of stress and urge together.
So let's talk about treatment options.
Yeah.
So there are so many treatments. This is why it's important for us to talk about it. So first off, we always talk about behavioral modifications. So we don't know it, but like we do a little diary with our bladder, like how much fluid are you taking? We talk about understanding what your fluid intake is, how often you're going. Can we change the timing? Can we decrease what you're taking in maybe at nighttime so you're not peeing through the night, for example? Bowel care. Anytime I talk about pee, I talk about poop because you have to talk about it. Like bowel care, if you're constipated, it's going to press on the bladder and decrease the size of your bladder capacity. And so you want to make sure that you're treating constipation while you're also treating bladder issues. Pelvic floor physiotherapy. We always talk about loose pelvic floor muscles as being an issue, but also tight pelvic floor muscles can cause pain and incontinence for some people. So working with a pelvic floor physio, medications are an option, especially for urge incontinence. We can help with relaxing the bladder. And then pessaries, if you have prolapse or anatomical issue where the bladder falls or the uterus falls or the rectum falls, we can give you a pessary so you can avoid surgery, for example.
Pessary?
It's like a little plastic tool that we put insert, and it holds your bladder up.
Wow.
And so it's an option before surgery for people. So,
So that's non-surgical.
it's non-surgical. So we remove it every few months. We wash it and we put it back in, and then patients come in and we remove it, wash it, put it back in. So it's a great option in surgery for those who might need it.
Right.
And pelvic floor.
And pelvic floor physio, yes, absolutely. So pelvic floor physio is a great option too.
Talk about, I don't think a lot of people realize the impact that menopause can have specifically on bladder health.
Yeah.
Why?
So much so. So we have a term for this. It's called genitourinary syndrome of menopause. Estrogen is the hormone that decreases rapidly in menopause and continues for the rest of our life. And estrogen feeds the bladder tissue, the urethra, the vagina. It affects the vaginal microbiome, and it increases when the estrogen levels go down in menopause and beyond. It increases the risk of vaginal dryness, bladder irritation, incontinence, and UTIs. I have patients who are in their 70s and 80s who come in and they've been on recurrent antibiotics because of infections because we're not treating their menopause symptoms. And they're like, I was done with menopause 20 years ago. And I'm like, no, your menopause is continuing because it's affecting the bladder health. So let's treat you with vaginal estrogen. Local estrogen, very safe, and actually it prevents them from needing antibiotics if we treat it properly because it restores the tissue. So they stop taking their antibiotics if we treat their vaginal tissue.
Wow, that is interesting. So what are some big takeaways? How can we all maintain our bladder health optimally?
Yeah, absolutely. So hydration, again, is the first thing that we always talk about, not only because it helps flush out bacteria, but it also decreases irritation in the bladder. Concentrated urine is irritating to the bladder. So you want to make sure that you're hydrating well. You want to avoid those bladder irritants. So things like alcohol, cigarette smoke, like citrus fruits can irritate the bladder. Caffeine can irritate the bladder. You want to decrease, if you're prone to it, you want to decrease that.
Right.
Smoking I bring up because smoking is a risk factor for bladder cancer. It's one of the biggest risk factors for bladder cancer. So if you can decrease your smoking or quit, that's very helpful as well. Pelvic floor physio, I can't say enough about my pelvic floor physio colleagues. They do so much for our patients, and it's really important to engage in that. And as always, talk to us as your healthcare providers. There are options, there's medications, there's lifestyle changes that we can make. Bladder health affects your overall health, and we're here to support you.
Dr. Sheila, this was incredible. Thank you so much. I feel like I learned so much. Okay, so stick around. We're going to be right back.
Did you learn this much?
Hey, you, come a bit closer. We've got so many more must-see interviews, spicy debates, lifestyle tips, and pop culture moments. So subscribe to our channel by tapping the logo below and don't miss out.